Good morning. So in the last part of our this class, that is the basic concept in endocrine pharmacology. See, we have seen the different types of the glands. Clear? We have seen about the different types of the glands like pineal glands, hypothalamus. Then we have seen about the pituitary, thyroid, thymus, lungs. Then you can say that what are the hormones it is secreting from the pancreas, adrenal glands, then you can say the testes, ovary, parathyroid glands, thyroid glands. So all those things we have seen. Now these are the, you can say that whenever we are talking about these hormones, they having some specific target and specific function. Already we have seen about the specific function of the different types of the hormones, but overall they are useful to the maintenance of the different functions of the body. Now, overall function, if we are talking about this endocrine system, they are helpful into the organic metabolism and H2 and maintaining the electrolyte balance, which are important to maintain the constant and internal environment. So these are the important for the maintenance of the internal environment. Next is inducing adaptive changes to help the body cope with the stress situation. Now in case of the stress situation, body is adapting that condition to maintain that it is helpful. Promoting the smooth subsequential and development. So in the every organ, their development, you can say that proper growth, all those things, it is regulated by the hormone. Controlling reproduction, to control the reproduction, it will be helpful. Regulating blood cell production, it will be helpful, along with the autonomic nervous system, controlling integrating activities of the both circulatory and digestive system. So that is the overall function of the endocrine system, and already we have seen what is their specific function, how they are going to act. So already we have seen their specific functions. Now this is the some of the example. Plus some of the example, though as I have told that details we will discuss in the details. The different hormones may act, they having the specific function, but how they are going to produce their effect? They may produce their effect via the different types of the receptors. Now what are the things? For example, if we are talking about the lipid soluble hormones, lipid soluble hormones, they are mainly acting on the nuclear receptor, nuclear receptor. So here we can find that nuclear receptor. Now in the nuclear receptor, these are the, you can say that like steroids and all those things, it will going to act, and after that going, they are producing the new protein, and through this new protein the function is initiated. Some water soluble hormones are also is there. Water soluble hormones, they may be act on the G protein coupled receptor. Yes, they may be act on the G protein coupled receptor. In the G protein coupled receptor, they are producing effect by the production of the cyclic AMP. After the cyclic AMP, that is again the activation of the protein kinase and the protein phosphorylation is takes place. That means what you want to say that different type of the hormones, it will act into the different mechanism, but it may act via, for example, defined receptor. For example, a nuclear receptor, it may act on the G protein coupled receptor. So this is overall about the different types of the hormone, and these are also, you can say that they are mainly regulated by the signal from the nervous system, chemical change into the blood, and due to the other hormones. So these are the things, you can say that the main trigger which regulating the hormone release. Now there may be disease arises due to the abnormal secretion of hormones. It may be the increased secretion or it may be the decreased secretion. For example, too little secretion secreted by the endocrine gland, that is the hyposecretion. Increased removal of the hormone from the blood. For example, anyhow the production is there, but it is removed, eliminating from our body, you can say that in the larger rate or quickly, then it may be problem. Abnormal tissue responsiveness, that means every hormone having its own target organ. Now they are going to act on the target organ, but tissue is not responsive. So these are the things, it may be happen, which may and disease may cause due to this particular situation also. Or sometimes what happen, we are you can say that there is a disease into that infection into the particular organs, that may be also there, which is called the decrease hormone activity. Too much hormone activity, it is, if it is secreting into the more quantity, hypersecretion, reduce the plasma protein binding with the hormone. Now plasma protein binding is important because free hormone is required for the function, so more free hormones, if it is present more quantity of the free hormone, then the effect also it will more decrease removal of the hormones from the blood, decrease inactivation or the decrease excretion. So all those also it is related with the increased hormone activity. These are the some of the references to go through, and along with that also you can say that like Tortora already, in case of the anatomy physiology, have studied the very wonderful book Tortora. You can go through for the details.